public, private, and non-governmental entities. Through the strategic partnerships with these sectors, including faith-based organizations, the government has expanded healthcare access nationwide and enhanced capacity to tackle health challenges and emergencies efficiently. It is important to state simply, directly, and clearly that the U.S. government has been our greatest ally in this sector. The President's Emergency Plan for AIDS Relief, PEPFAR, stands as a remarkable example of our fruitful partnership in combating HIV/AIDS for over 20 years, transforming despair into hope and prosperity. Together, we've turned a once fatal disease into a manageable condition, achieving significant success in global health.
The polls, we had a competition. We were told there is something called deep state. We were told there is something called system, but the people of Kenya decided. And because the people of Kenya have decided, we have no option but today to work together to make sure that we invest appropriately and correctly in agriculture. When I came into office, I said we are not going to subsidize consumption. We are going to invest in production. The price of bunga a year and a half ago was 20. Today it is 100 shillings.
The impact, innovation, and focus of the collaboration between Kenya and CDC has set a standard that transcends our boundaries. Another organization which highlights the positive impact of effective partnership between Kenya and United States organizations is the Kenya Medical Research Institute.
Meri ya